It's been 1 week now since state leaders announced Indiana's roadmap to reopen, and we're already seeing the next steps of stage 2 start to unfold. For instance, Monday, hair salons, nail salons, barbershops, and spas can reopen. There are restrictions in place like appointment requirements and social distancing guidelines. Restaurants and bars serving food can also reopen at half capacity for dine-in service. We continue to see numbers go up across the state. More than 23,000 positive cases. 1,328 Hoosiers have now died from COVID-19, and more than 130,000 Hoosiers have now been tested. Marion County continues to be a real hot spot across the state. More than 7,000 cases and 403 deaths. We're also keeping a close eye on what's happening in some of the surrounding counties. Look at what's happening in Hendricks County, 927 positive cases there. Hamilton County has 902, and Johnson County has 769. We're also keeping a close eye on what's happening up in Cass County with 1,497 positive cases. We've seen constant growth in positive cases across Indiana since early March, but look at this. The increase between March 19th and April 9th was more drastic than what we've seen in the last few weeks. Now, we talk about the efforts to flatten the curve. State leaders do believe we've already peaked in Indiana and have now started to plateau. But the governor said today they are ready to pull back on these reopening stages if we see a sudden shift.
Just by the very definition of what this virus is, we're going to have to be nimble. We're going to have to be agile. We're going to have to be willing to change course.
And as of today, churches across Indiana can now reopen their doors to congregations with limitations, though, on attendance. In fact, leaders of Cornerstone Lutheran Church, they have several social distancing measures right now in place, starting from the parking lot and extending all the way into the church. Their goal, like many others this Sunday, is to celebrate this Mother's Day and the church reunion safely.
This is a day that has been 2 months coming. Since we couldn't meet together, everyone's really been anxious to get back together and get back together in some sense of personal space, some sense of sacred space.
The church has 3 locations in Fishers, Carmel, and Indianapolis. Only the Fishers and Carmel locations are opening, with Marion County still under a stay-at-home order. The church will continue its online services, but if you would like to attend in person, you have to register first online.
And tonight at 11, we're digging into this viral documentary about COVID-19 that's posted all over social media. By now, you've probably seen or heard about Plandemic. We're getting lots of questions tonight from people at home wondering if some of these claims are true. So our Verify team found there's a lot of false information in the first few minutes alone.
It's called Plandemic, a 25-minute video claiming to show the real story behind COVID-19. YouTube is deleting it for violating guidelines on COVID misinformation, but that hasn't stopped tens of millions of people from sharing it on other platforms. So we're going to dive into this, but first, we want to focus on who is putting this together. On their website, the creators say the purpose of Plandemic is to, quote, expose the scientific and political elite who run the scam that is our global health system, while laying out a new plan that allows all of humanity to reconnect with healing forces of nature. So they've got a message they're trying to send, and they do it in this snappy-looking documentary. Let's go.
Dr. Michaelvitz published a blockbuster article in the journal Science. The controversial article sent shockwaves through the scientific community as it revealed that the common use of animal and human fetal tissues were unleashing devastating plagues of chronic diseases. For exposing their deadly secrets, the minions of Big Pharma waged war on Dr. Michaelvitz.
Okay, we're 45 seconds in and we have to stop. Dr. Judy Mikovits was a researcher at the National Cancer Institute, and in 2009, at a different research institute, she published a study in the journal Science. But that study was retracted 2 years later, and Mikovits was fired. The video claims it was for exposing deadly secrets. That's false. 10 independent studies tried to recreate Mikovits' study. They all failed. So the journal retracted it and said the first test likely had contaminated samples. Let's keep going.
The game is to prevent the therapies till everyone is infected and push the vaccines, knowing that the flu vaccines increase the odds by 36% of getting COVID-19.
Stop there. This is false. the flu vaccine does not increase the chances of getting COVID-19 by 36%. That claim comes from a misrepresented study. The real study by the Department of Defense was testing whether the flu shot made you more likely to get other viruses. But after testing, the conclusion was no. The flu vaccine didn't increase the odds. And that study was in 2017, before COVID-19 existed. Back to the video.
Wearing the mask literally activates your own virus. You're getting sick from your own reactivated coronavirus expressions. And if it happens to be SARS-CoV-2, then you've got a big problem.
Let's stop here. This is false. In another interview, Mikovits explained her belief that the virus doesn't spread from person to person, but instead gets injected with vaccines.
It's plausible, it's probable that it's been in every flu vaccine since 13 to 15, as that's when this work was being illegally done.
She believes the virus has been dormant in our bodies for years and that masks are causing it to, quote, activate. There is no evidence to support this claim. There are reasons it's false, like COVID testing. Millions of people worldwide are getting COVID tests. If this was a dormant virus in our bodies, the tests would still show it. There would be no negative results from anyone who's ever had a flu shot. And the idea that masks activated the virus doesn't add up either. The CDC and WHO initially didn't advise people wear masks, and for weeks, the virus was still spreading worldwide. So claim false. All right. One more time.
The AMA was saying, doctors will lose their license if they use hydroxychloroquine.
No, they did not say that. The AMA put out guidelines urging doctors be cautious using hydroxychloroquine, but they didn't threaten to revoke medical licenses because they can't. The AMA confirmed that they're a voluntary membership organization, not a regulatory one, and they have no control over licenses. And we're going to stop there. This video is snappy and well produced, but it's trying to push a narrative filled with falsehoods and a lack of evidence, meaning we classify this video as disinformation. With your Verify, I'm Jason Puckett.